Hello everyone and welcome back to the channel. Today, we are going to talk about a topic that affects millions of men worldwide. Yet it is something people often hesitate to discuss openly. Have you ever experienced a situation where your penis does not get tight enough during intimacy? Or perhaps it becomes soft right in the middle of sex or even right before ejaculation? If you have faced this, please know one thing. You're absolutely not alone, and this is completely treatable. This condition is medically known as erectile dysfunction or ED. In this video, we are going to break down exactly why this happens and give you a step-by-step, 100% effective approach to treating it safely and affordably. We will cover how to consult a doctor online, how to choose the right medication like Sildenafil Citrate, how to manage dosages from 20 milligauss up to 100 milligauss, and crucial safety warnings you must know. Make sure to watch this video until the very end because the information we are sharing today can truly transform your confidence and your relationship. As Section 2, Understanding the Root Causes of Erectile Dysfunction. Before we jump into the solution, let's quickly understand why this happens. An erection relies entirely on healthy blood flow. When you get excited, your brain sends signals to relax the blood vessels in your penis, allowing blood to rush in and create tightness. If this process is interrupted, the penis either stays soft or loses its hardness too quickly. The reasons can be divided into two main categories. Physical causes. This includes poor blood circulation, high blood pressure, diabetes, fatigue, or general weakness. Psychological causes. Stress, performance anxiety, depression, or even the fear of losing your erection during the act can trigger it. The good news? Modern medicine has made treating this incredibly simple and accessible. Let's look at exactly how you can fix this from the comfort of your home. Section 3. The step-by-step guide to getting medical help online. If you are dealing with mild to severe ED, the most common and effective first-line treatment is a medication called Sildenafil Citrate. Now, you might feel embarrassed going to a physical pharmacy to buy this, but you don't have to worry. You can easily order this medication online through trusted digital platforms or Amazon Pharmacy. Because Sildenafil is a prescription-only medication, you cannot buy it over the counter without a doctor's approval. However, online pharmacies have made this process completely seamless and private. Here is exactly how it works. Step 1. Choose your medication. Search for Sildenafil Citrate tablets on a registered online pharmacy. Step 2. Opt for doctor consultation. When you add the medicine to your cart, the platform will prompt you with a doctor consultation option. Step 3. Book your slot. You can select a convenient time slot for a qualified doctor to call you. Step 4. The consultation call. When the doctor calls, be completely honest with them. Tell them you are experiencing symptoms of erectile dysfunction. Inform them about how long you've had this issue, your current lifestyle, any other medical conditions you have, and any other medications you are currently taking. Step 5. Get your lifetime prescription. Once the doctor verifies your details, they will digitally sign a prescription and automatically upload it to the pharmacy system to fulfill your order. Pro tip: make sure to download a copy of this digital prescription to your phone or computer. The next time you need to reorder your medicine, you won't need to do the doctor consultation again. You can simply upload your downloaded prescription and check out instantly. It saves you both time and money. Section 4. How to start. Sildenafil Citrate. 20 milligauss. When you are starting out, it is always best to begin with a low, safe dose. We recommend starting with Sildenafil Citrate tablets IP 20 mg. This is a highly affordable, safe, and entry-level dose that works beautifully for mild cases of ED. Here is how to use it for the best results. Take one tablet exactly 1 hour before you plan to have sexual intercourse. You can take it with a glass of water. It is important to understand how this medicine works. It does not automatically give you an erection just by swallowing it. Once the 1 hour has passed and you begin intimacy, you need to naturally stimulate and excite yourself. Once you are aroused, the medicine activates, opening up the blood vessels. Your penis will become firm, tight, and it will stay hard throughout the entire session. It prevents premature softness entirely. Once you ejaculate and the intimacy is over, the penis will naturally return to its relaxed, flaccid state. For many men, introducing this 20 milligauss routine into their regular intimate life is more than enough to completely restore their performance. Section 5. What to do if 20 milligauss doesn't work? Stepping up to 50 milligauss and 100 milligauss. Now, what happens if you try the 20 milligauss dose, but you still struggle to maintain an erection? Don't panic. Everyone's body reacts differently to medication. If the 20 milligauss dose does not give you the desired tightness, you can step up the dosage, but you must follow a strict rule. Wait at least 24 hours before trying a higher dose. Never take multiple pills in a single day. Moving to Sildenafil 50 mg. The next logical step is trying a Sildenafil 50 mg tablet. This is a standard strength. At this dosage, you might experience mild temporary side effects. Some men notice a slight dimming or temporary darkness in their vision or mild acidity and stomach warmth. There is absolutely no need to worry. These symptoms are temporary and pass quickly as the medicine leaves your system. Moving to Sildenafil 100 mg, if your body requires a stronger push and the 50 mg dose still doesn't give you full firmness, you can advance to Sildenafil 100 mg. This is the maximum standard dose. The side effects here are similar to the 50 mg dose, such as mild vision changes, a flushed face, or a slight headache. But they might feel just a little more noticeable. Again, stay calm, drink plenty of water, and stay relaxed, as it is a completely standard bodily reaction to increased blood flow. Section 6. Critical safety warning. Who should not take this medication? While Sildenafil is incredibly safe for the vast majority of men, we must discuss a very critical medical warning. Critical warning. If you have any underlying heart conditions, history of heart attacks, severe high or low blood pressure, or if you take medications containing nitrates, often prescribed for chest pain, you must absolutely not take Sildenafil. Sildenafil significantly alters your blood pressure to improve flow. Mixing it with heart conditions or nitrate medications can cause a dangerous, life-threatening drop in blood pressure. If you have a heart condition, please bypass online ordering entirely and consult your primary cardiologist in person to discuss safer, tailored alternatives for your sexual health. Section 7. Alternative solutions. Long-lasting performance. Before we wrap up, let's look at an alternative scenario. What if your issue isn't just getting hard, but you also struggle with lasting long enough? Or you find that you lose your tightness too quickly during a prolonged session? If you want an option that specifically helps maintain stiffness while delaying ejaculation, you can talk to your doctor about combination tablets, such as the Manforce Stay Long Plus tablet. This type of medication combines erectile support with ingredients designed to give you greater endurance, helping you stay in control of your climax and keep your erection firm for a longer duration. Section 8. Conclusion. To sum it all up, erectile dysfunction is a very common physical hurdle, not a personal failure. Thanks to modern telemedicine, you can privately, safely and affordably order Sildenafil citrate online, get a legal digital prescription, and reclaim your confidence. Start low at 20 mg and adjust carefully if needed. Always prioritize your heart health and communicate openly with your partner. If you found this guide helpful, clear, and informative, please make sure to give this video a thumbs up. Subscribe to our channel for more straightforward health guides and share this video with someone who might need it. Thank you so much for watching. Take care of your health, and we will see you in the next video.